What's up, good people? Today I'm going to talk about a very interesting and very impressive thing that can tell people that whether they have diabetes or not, or whether their diabetes is getting worse or not. And this is just a physical thing that you can look in your body and then tell yourself that you need to see your diabetes doctor, or you need to see your primary care doctor, or you need to get some testing done for your diabetes, especially HbA1c. So let's talk about it. High A1c is a very, very strong predictor of diabetes. And in that connection, the researchers and the podiatrists and the hand surgeons, they found out and they came to this conclusion that there is a thing called trigger finger, and you can have a trigger finger, and that relates to you having high A1c. And we all know that high A1c relates to diabetes, whether it's type 1 diabetes or type 2 diabetes, juvenile diabetes, or gestational diabetes. You name a type of diabetes, A1c is a strong predictor when it comes to that. And when you can relate that A1c to something that is physical, to something that you don't even need to poke and just assess then and there. That's where you call yourself as a physician. And that's what I am relating here, that yes, you can see that, and yes, you can tell yourself, or you can tell your patient that yes, let's go for an A1c test in your case. So what is a trigger finger? Trigger finger is a condition in which one of your fingers literally gets stuck in a bent position. And then you literally go to a doctor sometimes, or you can pull it back on your own as well. But some people have it so bad that they end up going to the doctor. Especially sometimes they have to go to a hand specialist or hand surgeons, and or osteoarthritis specialist, and then they take care of it. And we all know that A1c is related to diabetes, but researchers found out that it's related to a trigger finger thing in both type 1 and type 2 diabetics. And it's an officially called thing in a scientific way, we call it as stenosing flexor tenosynovitis. I know that sounds really fancy, but that's an official term for a trigger finger. And it's a common disorder. It's a common disorder affecting both the flexor tendons and the tight pulleys that surround those tendons of your fingers in your hands, and it ends up having a lock position in the flexion, and to snap kind of situation, uh, and that's why it's called like a trigger, and it's when manually pulled back. So you have to, if you can imagine it, it's like pulling a trigger of a gun or something like that. That could be an easier way to connect the things. So the likely cause is a combination of tendinopathy and pulley thickening, and that's how it happens. And this finding suggests that the optimal treatment of diabetes seems to be of importance for prevention of diabetic hand complications such as trigger finger. And that's what is fascinating for me to bring it here, that yes, there is a thing that can happen to your skin, that can happen to your joint, literally in your hand, and you're looking at it, and you can tell that it could be a sign of diabetes. And that's why he says that in a prior study that was published in earlier in 2022, based on the same Swedish data sets, and they found out that the diabetic hand phenomena includes the previously recognized trigger finger and Dupuytren's disease, as well as the carpal tunnel syndrome or the ulnar nerve entrapment. So these are the things that you literally see in your hand or the wrist, like carpal tunnel syndrome or ulnar nerve entrapment, and possibly the osteoarthritis of the first carpal metacarpal joint. all conditions are more common in the patients who have type 1 diabetes than those without diabetes or with either type of diabetes. So, why not? If you're having problems in your hands, go to your doctor and have the A1c done if you are having other suspicions as well, because this is one of the physical signs that is connected to it. And the hand surgeons, they came up with this kind of observations, and they are bringing the publications that yes, there is another way to catch the thing earlier than you could have. So, as a hand surgeon, this guy is saying that I think clinicians should always screen for hand problems in people with diabetes. It's an easy question. Just ask your patients, or if you are not even a doctor, you can ask your family member who is going through this that are you having problems with your hands? It's an open question, and you can ask it in literally 2 seconds. And of course, the heart, eye, and kidney problems are more important, but fingers getting stuck and not being able to use your hand is also quite disturbing. And that's what is important in this kind of scenario, because then you are treating this condition with the steroid injections, or sometimes you have to do them surgically. You literally have to snap it open surgically, and the injections, which often dramatically raise the blood glucose levels temporarily, also aren't always a permanent treatment. So earlier you catch, the better it is. And people with diabetes tend to recover from trigger release surgery a bit more slowly, because in diabetics the healing phenomena are delayed. So you can tell your patients with diabetes it might take some time, but you will recover. So what they did is, in order to find this connection, they did a huge study, the direct relationship of A1c and trigger finger was found out through this study that I am, discussing right now here, that the population is huge. They studied close to 10,000 adults and with type 1 diabetes, and 85,755 adults with type 2 diabetes from the Swedish National Diabetes Register from this year 2004 to 2019. And these data were cross-linked to those of the region in their healthcare database, the scans, which included all diagnoses for 1.1 million adults. Over the study period, they found out that there is a strong correlation, and the mean A1c was higher for both men and women diagnosed with trigger finger. That's the turning point. That's the turning point of the study, that you are getting a physical sign that relates to a pathology, that relates to a medical condition, which is a big syndrome. Diabetes is something that relates to every healthcare professional, because no matter what sort of healthcare professional you are, you will see a diabetic patient affecting that particular part of your body. Let's say if you are a dermatologist, you will see diabetic patients because diabetes have skin complications. If you are an eye doctor, it's impossible that you will never see a diabetic patient who got diabetic eye complications. So, yes, please pay attention. That's the main point here. That's what I'm trying to convey here. So, both men and women were diagnosed with the trigger finger had a longer duration of diabetes for both type 1 and type 2 diabetes. That's another point. If you have trigger finger, you are going to have a long duration diabetes, whether it's type 1 or type 2. The associations were significant both with A1c as a continuous variable and when divided into tertiles by mean A1c, A1 after adjustment for the confounders like age, smoking, diabetes duration, BMI, blood pressure, and so on and so forth. And the greatest risk for trigger finger was found in men with type 1 who had A1c of more than 64 millimoles, which is 8%. So, yeah, if one thing is disturbed, the other is related to that. So, both depend on each other. High A1c, higher chance of trigger finger. High trigger finger, yes, high chance of being diabetic with a high A1c. So, yeah. And similar things with an odd ratio of 5.33 compared with men with type 1 diabetes who had A1c levels of less than 48 millimoles, which is 6.5%. So higher the A1c, higher is the chance of trigger finger, whether it's type 1 or type 2 diabetes. So pay attention to your body and talk to your doctor